right, welcome to the Experience Better video podcast series. I'm Josh Beekler, physical therapist, and Jenny Everly with me today, physical therapist here at Grand Island Physical Therapy. And today we're going to talk about the core, back pain, those kinds of things. So when we talk about the core, what are we even talking about?
Well, the best way I describe it to people is you think about your ultimate six-pack on your very fit people.
Right.
And everyone does stuff for the upper four, but doesn't always do stuff for the lower two.
Right.
It gets forgotten because no one likes those exercises. Because those are planks and leg lifts.
They're harder.
They're way harder than just doing sit-ups.
Right.
So that's what gets forgotten a lot, and that's how I always explain it to patients.
Sure, very good. So a lot of people come in with back pain. It's it's a very, very typical thing we see. What are kind of the most reasons people have back pain?
Most of the time, if it's a younger population, they've had an injury where they throw out the alignment of their back. They have muscle spasms. As we get older, unfortunately, we get muscle tightness. We have tight hamstrings and hip flexors that pull on our back and contribute to tightness and pain in our back.
So even when you talk about back pain, you referred to tight hip muscles, tight hamstrings. A lot of times people don't think or are surprised to hear that their hamstrings are the reason their back pain, or tight hip flexors are the reason for their back pain.
If your hamstrings are tight, you're more likely to have back pain. That's just a direct correlation.
Right, and then if your hip flexors are tight, something has to extend your body, and then a lot of times your back, if your hips won't go,
they just naturally rotate them forward, and you get more of a sway in your low back.
And generating more back pain. And so what are some common things you can do to treat back pain, or what are things what are kind of your go-tos?
Well, of course, we always do exercises. We strengthen and stretch, just what we've addressed. But also, I do a lot of dry needling, cupping to address those tight muscles. So we work out the tight muscles. We do muscle energy techniques that uses your own muscles to pull your spine into alignment, and we make sure it's aligned too, and then give you the stretches usually.
Right. So getting the right muscle stretched and the right muscle strengthened is a critical piece of that.
Just the balance.
Right. While also, at the same time, like you mentioned the modalities like the needling and the cupping to kind of get you over the hump of that pain and speed it up a little bit and make it a little more bearable. But like you said, that the true core of core exercises or core strengthening, it takes quite a while. I mean, you got to stretch for a while, you got to keep strengthening a while, you got to be diligent about it.
I always warn people, it takes a good 6 weeks to see changes.
Right.
I can calm the pain down and get them over that hump, but the exercises, you have to be diligent for them 6 weeks to see any strengthening happen.
Yep.
And none of us are that patient.
No, we aren't. It's tough, yeah. So if you're having any back pain or want to learn more about your core and general exercises you can do, come see Jenny here at the Grand Island Physical Therapy. And Jenny, what do you think? Husker season's upon us. Any predictions for how we're going to do this year?
I think it will be better. I just hope that fans are patient.
Right. Yeah. What's your record prediction?
Oh gosh.
They play 12 games.
They play 12 games.
Right, there you go.
Let's say
8-4 she goes with. So you heard it here. You can give Jenny a hard time if she's wrong, but hopefully we can be even better than that.
Yes.
8-4 would be awesome. So thanks for tuning in, and we'll see you next time.